वेलकम ब्याक अल अफ यु। आज हामी सेट 4 को पार्ट 2 लिएर आइसकेका छौँ। अब ढिला नगर्न डाइरेक्ट क्वेसनतिर लागौँ। र त्योभन्दा पहिला म यो भन्न चाहन्छु कि हजुरहरू अहिलेसम्म सब्सक्राइब गर्नुभएको छैन भने प्लिज सब्सक्राइब गरिदिनु होला र लाइक गरिदिनु होला र चाहिने साथीहरूलाई सेयर गरिदिनु होला। धन्यवाद। र अब क्वेसन नम्बर 1 मा रहेछ, which of the following is a common sign of aging in the cardiovascular system? Option A, decreased blood pressure. Option B, increased heart rate. Option C, stiffening of blood vessels. Option D, reduced cardiac output. यसको सही उत्तर हो अप्सन सी, स्टिफनिङ अफ द ब्लड भेसल्स। के कारण हुन्छ भने हाम्रो एजिङ बढ्दै जाँदाखेरि हाम्रो ब्लड भेसलको इलास्टिसिटी कमजोर भएका कारणले हाम्रो ब्लड फ्लो बढी हुन जान्छ। वेल, त्यसै गरी हामी क्वेसन नम्बर 2 मा हेरौँ त, वाट इज द प्राइमरी कन्सर्न वेन एडमिनिस्टरिङ मेडिकेसन टु इल्डरली पेसेन्ट्स? अप्सन ए मा रहेछ इन्क्रिज ड्रग मेटाबोलिज्म. Option B, alterate drug absorption and excretion. Option C, enhance sensitivity to drugs. Option D, enhanced immune function. यसको सही उत्तर हो अप्सन बी, alterate drug absorption and excretion. Well, त्यसै गरी हामी क्वेसन नम्बर 3 मा लागौँ त, the most effective way to prevent breast ulcer in elderly patient is option A, frequent repositioning. Option B, use of moisturizers. Option C, increased calorie intake. Option D, administering pain relief. यसको सही उत्तर हो अप्सन ए, फ्रिक्वेन्ट रिपोजिसनिङ। हामी फ्रिक्वेन्ट रिपोजिसनिङ गरेर प्रेसर अल्सरबाट बचाउन सक्छौँ। वेल, त्यसै गरी हामी क्वेसन नम्बर 4 मा हेरौँ त, a geriatric patient complains of difficulty sleeping. Which of the following interventions should the nurse prioritize? Option A, recommended the use of sleeping pills. Option B, assess the patient for underlying cause such as pain or anxiety. Option C, suggest a caffeine-free diet. Option D, avoid encouraging physical activity. यसको सही उत्तर हो अप्सन बी, assess the patient for underlying cause such as pain or anxiety. Well, त्यसै गरी हामी क्वेसन नम्बर 5 मा हेरौँ त, which of the following is a common age-related change in the gastrointestinal system of elderly individuals? Option A, increased gastric acid secretion. Option B, decreased peristalsis. Option C, increased liver function. Option D, reduced risk of constipation. यसको सही उत्तर हो अप्सन बी, डिक्रिज्ड पेरिस्टाल्सिस. वेल, त्यसै गरी हामी क्वेसन नम्बर 6 मा हेरौँ त, वाट इज द मोस्ट कमन कज अफ हिप फ्र्याक्चर इन एल्डरली पेसेन्ट? अप्सन ए, ओस्टियोआर्थराइटिस. अप्सन बी, ओस्टियोपोरोसिस. अप्सन सी, हाइपरटेन्सन. अप्सन डी, डायबिटिज. यसको सही उत्तर हो अप्सन बी, ओस्टियोपोरोसिस. वेल, त्यसै गरी हामी क्वेसन नम्बर 7 मा हेरौँ त, इन ओल्डर एडल्ट्स the decline in kidney function may lead to option A, increased clearance of drugs. Option B, decreased drug toxicity. Option C, reduced excretion of drug. Option D, increased urine output. इसको सही उत्तर हो ऑप्शन सी, reduced excretion of drug. Well, त्यसै गरी हामी क्वेसन नम्बर 8 मा हेरौँ त, the best method to assess pain in a non-verbal elderly patient is option A, rely on the patient's family's input. Option B, use a pain scale with facial expression. Option C, measure vital signs exclusively. Option D, observe the patient's behavior and body language. यसको सही उत्तर हो ऑप्शन डी, observe the patient's behavior and body language. Well, त्यसै गरी हामी क्वेसन नम्बर 9 मा हेरौँ त, which of the following is an important intervention for managing dementia in older adults? Option A, restricting social interaction. Option B, providing structured daily routines. Option C, limiting physical activity. Option D, encouraging prolonged periods of isolation. इसको सही उत्तर हो ऑप्शन बी, providing structured daily routines. Well, त्यसै गरी अब हामी क्वेसन नम्बर 10 मा हेरौँ त. Which of the following is most commonly associated with the delirium in elderly patients? Option A, chronic pain. Option B, medication side effects. Option C, progressive neurological or disorders. Option D, nutritional deficiencies. यसको सही उत्तर हो ऑप्शन बी, medication side effects. Well, त्यसै गरी अब हामी क्वेसन नम्बर 11 मा हेरौँ त. The most common mental health disorder affecting older adults is option A, bipolar disorder, option B, depression, option C, anxiety disorder, option D, schizophrenia. यसको सही उत्तर हो ऑप्शन बी, डिप्रेसन. त्यसै गरी हामी क्वेसन नम्बर 12 मा हेरौँ त. What is a significant risk factor for adults in older adults? Option A, hypertension. Option B, polypharmacy, use of multiple medications. Option C, increased physical activity. Option D, decreased cholesterol levels. इसको सही उत्तर हो ऑप्शन बी, polypharmacy, use of multiple medications. Well, त्यसै गरी हामी क्वेसन नम्बर 13 मा हेरौँ त. Which of the following is a key consideration when performing a health assessment of an elderly patient? Option A, focus only on physical health problems. Option B, consider cognitive and emotional health. Option C, do not inquire about the patient's social history. Option D, do not discuss advanced care plan. इसको सही उत्तर हो ऑप्शन बी, consider cognitive and emotional health. त्यसै गरी हामी क्वेसन नम्बर 14 मा हेरौँ त. In geriatric nursing, which of the following can help prevent dehydration in elderly patients? Option A, administering large amount of fluid in one go. Option B, offering fluid regularly throughout the day. Option C, encouraging coffee or tea only. Option D, avoiding fluid intake before bedtime. यसको सही उत्तर हो ऑप्शन बी, offering fluid regularly throughout the day. Well, त्यसै गरी हामी क्वेसन नम्बर 15 मा हेरौँ त. Which type of exercise is most beneficial for elderly patient with osteoarthritis? Option A, high impact aerobics. Option B, weightlifting. Option C, gentle stretching and low impact exercise. Option D, competitive sports. यसको सही उत्तर हो ऑप्शन सी, gentle stretching and low impact exercises. Well, अब त्यसै गरी हामी क्वेसन नम्बर 16 मा हेरौँ त. What is an appropriate nursing intervention for managing urinary incontinence in elderly patients? Option A, restricting fluid intake. Option B, offering toileting assistance at regular intervals. Option C, using indwelling catheter at all time. Option D, encouraging the patient to avoid fluid afternoon. इसको सही उत्तर हो ऑप्शन बी, offering toileting assistance at regular intervals. Well, त्यसै गरी हामी क्वेसन नम्बर 17 मा हेरौँ त. Which of the following is the most appropriate method to promote skin integrity in elderly patients? Option A, using talcum powder on dry skin. Option B, moisturizing and hydrating the skin. Option C, restricting patient movement. Option D, keeping skin exposed to sunlight. इसको सही उत्तर हो ऑप्शन बी, moisturizing and hydrating the skin. Well, त्यसै गरी हामी क्वेसन नम्बर 18 मा हेरौँ त. What is the primary goal of palliative care for older adults? Option A, cure the illness. Option B, provide comfort and improve quality of life. Option C, focus on aggressive treatment options. Option D, promote independence regardless of health status. यसको सही उत्तर हो provide comfort and improve the quality of life. Well, त्यसै गरी हामी क्वेसन नम्बर 19 मा हेरौँ त. Which of the following is a common side effect of polypharmacy in older adults? Option A, enhanced medication efficacy. Option B, increased risk of adverse drug reaction. Option C, improved memory function. Option D, increased physical strength. इसको सही उत्तर हो ऑप्शन बी increased risks of adverse drug reactions. Well, basically on question number 20 માં હેરો હતા. The nurse is teaching a family about caring for an elderly patient with Alzheimer's disease. What is the most important point to emphasize? Option A, encouraging independence in all daily activity. Option B, use reality orientation technique consistently. Option C, avoid changing the patient's routine. Option D, limit social interaction to prevent confusion. इसको सही उत्तर हो ऑप्शन सी avoid changing the patient's routine. Well, this is question number 21 માં હેરો હતો. A child is brought to the clinic with a persistent cough, wheezing and difficulty breathing. The nurse suspects asthma. Which of the following is most common trigger of asthma in children? Option A, dust mites. Option B, cold weather. Option C, exercise. Option D, pollen. इसको सही उत्तर हो ऑप्शन ए डस्ट माइट. Well, basically on question number 22 में हेरो था. Which of the following is the first intervention for a child with a suspected foreign body aspiration? Option A, perform abdominal thrust. Option B, attempt to remove the object with a finger. Option C, encourage the child to cough forcefully. Option D, call emergency services. इसको सही उत्तर हो ऑप्शन ए परफॉर्म एब्डोमिनल थ्रस्ट. त्यसै गरी हामी क्वेश्चन नम्बर 23 मा हेरौँ त. A nurse is caring for a child with chickenpox. What is the most important nursing intervention for a child? Option A, administering acetaminophen to reduce fever. Option B, isolate the child to prevent spreading the infection. Option C, apply topical antibiotics to the rest. Option D, encouraging a high protein diet for faster healing. इसको सही उत्तर हो ऑप्शन बी isolate the child to prevent spreading the infection. Question number 24 में हेरौँ त. Which of the following is a typical development milestone for a 2-year-old child? Option A, can draw circles. Option B, can speak in complete sentence. Option C, can walk without assistance. Option D, can jump with both feet. इसको सही उत्तर हो ऑप्शन सी can walk without assistance. Well, त्यसै गरी हामी क्वेसन नम्बर 25 मा हेरौँ त. A child is receiving chemotherapy for leukemia. Which of the following is the most appropriate nursing intervention to minimize the risk of infection? Option A, encourage frequent hand washing. Option B, provide high protein foods. Option C, ensure a high level of physical activity. Option D, administer immunization as needed. इसको सही उत्तर हो ऑप्शन ए encourage frequent hand washing. Well, त्यसै गरी हामी क्वेसन नम्बर 26 मा हेरौँ त. A child with a history of eczema complains of itching and redness in the skin. The nurse should option A, encourage the child to scratch the affected area. Option B, apply a moisturizing lotion after bathing. Option C, keep the child in a warm, dry environment. Option D, use hair soap to clean the skin. इसको सही उत्तर हो ऑप्शन बी, apply a moisturizing lotion after bathing. Well, अब नेक्स्ट क्वेश्चन नम्बर 27 मा हेरौँ त. In children under 2-year-old, the most common site for a fever to be measured is option A, axillary, option B, rectal, option C, oral, option D, tympanic. इसको सही उत्तर हो option B, rectal, because a rectal temperature measure provides the most accurate reading for infant and older under 2-year-old. त्यसै गरी क्वेश्चन नम्बर 28 मा हेरौँ त. A nurse is preparing to administer a vaccine to a 6-month-old infant. Which of the following vaccines is typically administered at this age? Option A, hepatitis B. Option B, MMR, measles, mumps, rubella. Option C, DTaP, diphtheria, tetanus pertussis. Option D, varicella. इसको सही उत्तर हो ऑप्शन सी, DPT, diphtheria, tetanus pertussis. Well, त्यसै गरी हामी क्वेश्चन नम्बर 29 मा हेरौँ त. A child is diagnosed with hyperbilirubinemia. The nurse should expect to see which of the following symptoms? Option A, jaundice, yellowing of the skin and eye. Option B, increased urine output. Option C, decreased muscle tone. Option C, cyanosis. इसको सही उत्तर हो ऑप्शन ए, jaundice, yellowing of the skin and eye. Question number 30 मा हेरौँ त. The nurse is assessing a 4-year-old child for gross motor skills. Which of the following action would be appropriate for this age group? Option A, catching a ball with 2 hands. Option B, balancing on 1 foot for 10 seconds. Option C, walking up and on stairs without assistance. Option D, escaping with alternating feet. इसको सही उत्तर हो ऑप्शन सी, walking up and down stairs without assistance. त्यसै गरी हामी क्वेश्चन नम्बर 31 मा हेरौँ त. A child present with a fever, sore throat and red rash that appear after the fever. Nurse suspected scarlet fever. Which of the following is the most appropriate treatment for scarlet fever? Option A, antibiotics. Option B, antipyretics and fluids. Option C, topical corticosteroids. Option D, antiviral medication. इसको सही उत्तर हो ऑप्शन ए, antibiotics. Well, त्यसै गरी हामी क्वेश्चन नम्बर 32 मा हेरौँ त. A nurse is providing anticipatory guidance for a parent of a 10-year-old child. Which of the following is the most important to discuss regarding physical development at this age? Option A, puberty and its changes. Option B, sign of elderly childhood obesity. Option C, speech and language development. Option D, impact of nutrition on brain function. यसको सही उत्तर हो ऑप्शन ए, puberty and its changes. Well, त्यसै गरी क्वेश्चन नम्बर 33 मा हेरौँ त. When providing care to a child with cystic fibrosis, the nurse should focus on option A, encouraging high protein food and pancreatic enzymes replacement. Option B, promoting weight loss to prevent respiratory complications. Option C, restricting fluid intake to prevent dehydration. Option D, preventing the child from engaging in physical activities. इसको सही उत्तर हो ऑप्शन ए, encouraging high protein food and pancreatic enzyme replacement. Question number 34 मा हेरौँ त. The nurse is preparing to discharge a child with a diagnosis of type 1 diabetes. Which of the following instruction is most important for the parent to understand? Option A, the child should avoid carbohydrates. Option B, the child will need insulin therapy for life. Option C, insulin can be omitted if the child is ill. Option D, the child should avoid exercises. इसको सही उत्तर हो option B, the child will need insulin therapy for life. Well, त्यसै गरी हामी क्वेश्चन नम्बर 35 मा हेरौँ त. A 5-year-old child is being treated for an ear infection. Which of the following instruction should the nurse provide to the parent? Option A. Make sure your child gets plenty of rest and fluid. Option B. Use a cotton swab to clean the ear canal to prevent reinfection. Option C. Limit your child's fluid intake while they have the infection. Option D. Administer antibiotics for 1 to 2 days and then stop if the symptoms improve. इसको सही उत्तर हो option A. Make sure your child get plenty of rest and fluid. Question number 36 मा हेरौँ त. The nurse is caring for a child who is receiving an antibiotic for an ear infection. The child developed a rash, nausea, and vomiting. The nurse should option A. Continue the antibiotic therapy. Option B. Discontinue the antibiotic and notify the healthcare provider. Option C. Provide over-the-counter anti-nausea medications. Option D. Apply topical ointment to the rash. यसको सही उत्तर हो option B. Discontinue the antibiotic and notify the healthcare provider. Well, त्यसै गरी हामी क्वेश्चन नम्बर 37 मा हेरौँ त. A 10-year-old child with a history of asthma is having an asthma attack. The nurse should prioritize option A. Administering a short-acting bronchodilator. Option B. Giving an oral steroid medication. Option C. Administering oxygen through a nasal cannula. Option D. Encouraging the child to rest. इसको सही उत्तर हो option A. Administering a short-acting bronchodilator. Well, त्यसै गरी हामी क्वेश्चन नम्बर 38 मा हेरौँ त. A child with a history of severe allergy is prescribed an epinephrine auto-injector. The nurse should educate the parent about option A. Using the auto-injector only when the child is unconscious. Option B. Injecting the medication through clothing if needed. Option C. Waiting for the child to express a severe allergy reaction before using the injector. Option D. Storing the auto-injector in the refrigerator. इसको सही उत्तर हो option B. Inject the medication through clothing if needed. Well, त्यसै गरी हामी क्वेश्चन नम्बर 39 मा हेरौँ त. A nurse is caring for a 2-year-old child who is receiving treatment for lead poisoning. Which of the following intervention is a priority? Option A. Administering iron supplement. Option B. Encouraging the child to drink a lot of water. Option C. Providing chelation therapy to remove lead. Option D. Offering a high protein diet. सही उत्तर हो option C. Providing chelation therapy to remove the lead. Well, त्यसै गरी हामी क्वेश्चन नम्बर 40 मा हेरौँ त. The nurse is providing care for a child with a fractured leg. Which of the following should be included in the discharge instruction? Option A. Avoid weight bearing activity for 6 weeks. Option B. Keep the cast dry and clean. Option C. Encouraging the child to engage in active exercises. Option D. Remove the cast if it becomes itchy. इसको सही उत्तर हो ऑप्शन बी, कीप द कास्ट ड्राई एंड क्लीन। वेल, त्यसै गरी हामी क्वेश्चन नम्बर 41 मा हेरौँ त। Which of the following is a typical sign of menopause? Option A, decreased bone density. Option B, increased menstruation. Option C, increased production of cervical muscles. Option D, irregular periods for several years. इसको सही उत्तर हो ऑप्शन डी, irregular periods for several years. Question number 42 मा हेरौँ त। The nurse is caring for a woman who had a cesarean section delivery 24 hours ago. She reports pain at the incision site. What is the most appropriate nursing action? Option A, administer an opioid analgesic as prescribed. Option B, apply a heating pad to the incision site. Option C, encouraging deep breathing exercises to manage pain. Option D, recommended the use of ice reduce swelling. तो सही उत्तर हो ऑप्शन ए, administering opioid analgesic as prescribed. Well, त्यसै गरी हामी क्वेश्चन नम्बर 43 मा हेरौँ त। A nurse is educating a woman with gestational diabetes. Which of the following is the most important dietary modification? Option A, increased protein intake. Option B, restrict carbohydrate intake. Option C, avoid fruit and vegetables. Option D, increase sugar intake for energy. इसको सही उत्तर हो ऑप्शन बी, restrict carbohydrate intake. Well, त्यसै गरी हामी क्वेश्चन नम्बर 44 मा हेरौँ त। Which of the following is a common complication of an episiotomy? Option A, infection. Option B, prolonged labor. Option C, eclampsia. Option D, preterm labor. इसको सही उत्तर हो ऑप्शन ए, infection. Question number 45 मा हेरौँ त। A woman in labor is requesting pain relief. Which of the following is the most commonly used non-pharmacological method for managing labor pain? Option A, Lamaze breathing techniques. Option B, epidural analgesia. Option C, nitrous oxide inhalation. Option D, opioid medications. इसको सही उत्तर हो ऑप्शन ए, Lamaze breathing techniques. Well, त्यसै गरी क्वेश्चन नम्बर 46 मा हेरौँ त। A nurse is caring for a woman with endometriosis. Which of the following is a common symptom of this condition? Option A, painful menstruation. Option B, unexplained weight gain. Option C, elevated blood pressure. Option D, increased appetite. इसको सही उत्तर हो ऑप्शन ए, painful menstruation. Well, त्यसै गरी हामी क्वेश्चन नम्बर 47 मा हेरौँ त। A woman is diagnosed with polycystic ovary syndrome (PCOS). Which of the following is a common treatment option for managing this condition? Option A, oral contraceptive pills. Option B, insulin therapy. Option C, anti-inflammatory medication. Option D, antibiotics. इसको सही उत्तर हो ऑप्शन ए, oral contraceptive pills. Well, question number 48 मा हेरौँ त। A woman had just undergone a hysterectomy. Which of the following should the nurse prioritize during the post-operative period? Option A, providing emotional support related to infertility. Option B, encouraging elderly ambulation to prevent deep vein thrombosis. Option C, limiting fluid intake to prevent swelling. Option D, monitoring the woman's blood sugar level closely. इसको सही उत्तर हो Option B. Encouraging elderly ambulation to prevent deep vein thrombosis. Because elderly ambulation helps prevent complications such as deep vein thrombosis after surgery as it promotes circulation and reduces the risk of clot formation. Well, त्यसै गरी हामी क्वेश्चन नम्बर 49 मा हेरौँ त. A woman present with abnormal uterine bleeding, which diagnosis test would be the nurse expect to be ordered first? Option A, pap smear. Option B, transvaginal ultrasound. Option C, pregnancy test. Option D, hysteroscopy. इसको सही उत्तर हो ऑप्शन बी, transvaginal ultrasound. Well, त्यसै गरी हामी क्वेश्चन नम्बर 15 हेरौँ त. The nurse is caring for a pregnant woman at 12 weeks gestation with a history of recurrent urinary tract infection. Which of the following is the best approach to prevent further infection? Option A. Encourage frequent fluid intake and urination. Option B. Recommended the use of feminine hygiene sprays. Option C. Limit fluid intake to prevent swelling. Option D. Restrict sexual activities during pregnancy. इसको सही उत्तर हो ऑप्शन ए, encourage frequent fluid intake and urination. हस् त, धेरै धेरै धन्यवाद हजुरहरू यहाँसम्म हेरिदिनु भएकोमा. मन परेमा लाइक गरिदिनु होला, चाहिने साथीहरूलाई सेयर गरिदिनु होला.